coming this evening.
We're going to start.
We're going to start a call to order. And to open the meeting, we will stand and pledge allegiance to the flag.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. And with all the members here, we can declare a quorum.
And I certify the delivery of the official notices of the meeting was completed. Thank you, sir. Yep.
And the third element of the meeting regards to the minutes from the regular meeting of July 24th, 2024. Does anyone have any comments, corrections, or additions?
Nope.
No.
All right. Moving to the health district staff reports. No additional.
We gotta approve the minutes still.
Oh, sorry. Go
So,
ahead.
right, we need to approve the minutes.
Yes.
By,
Need a first?
yes,
Second?
I'll second.
All right. All those in favor?
Aye.
All
aye.
those opposed? Any abstentions? All right, hearing none, motion passes. So health district staff reports, population health, no update unless there's any questions. Any questions on that one? Not hearing, if there are any, we can always go back. Next one is environmental health, Mr. Lark.
Nothing to add, besides report. Almost all the entire staff will be out at the fair tomorrow to begin inspections of all the vendors selling food at the fair. So hopefully get that done tomorrow and finish up on Friday before it gets too hot.
It's already too hot.
Yeah, that's right, that's right.
True.
That is fair.
Any questions for Mr. Lark?
Nope.
All right.
And the administrator's report?
No update other than what Dan just said, which will be at the fair most of the week, so you can stop by and say hi. Other than that, no update.
Can you tell us more about the HDAC meeting?
Actually, so I wasn't able to be at that one. Mr.
Oh.
Lark and Ron were, so.
Can you tell us more about the HDAC meeting?
I'm trying to forget what we said.
There was a large discussion. We talked about just what was going on. We talked a lot about reparation and maintenance, actually. So the members of the HDAC that were there, I think some of them weren't familiar with it. They'd kind of heard about it, but not super familiar. So we actually spent time going over some of the ideas we had for the program, where it is now, and where we hope to take it, and some of the benefits we might be able to do for the residents that we're hoping. We're still waiting for some legal opinions. I don't know if we discussed using like some of the money, if there's extra money in the program, to use it to help like low-income residents, maintain their systems or pay for fees and stuff like that. So we reviewed some of those proposals with them. And we touched on housing a little bit with them too. So went over that and some of the restrictions we have versus what we might be able to do and what they may be looking for.
Yeah, I believe we talked about staffing with no turnover, those kind of things. We looked at the accreditation, we went through the community health assessment stuff, kind of did a highlight of all the things we've talked about for the last 6 months. All was very well received.
Do we have any updates on the methane issue?
Yeah, so I talked to Ohio EPA. So Parkman has a methane vein that goes through there. It's not just that one house that's called us. It's also the community center, which actually Ms. Brakey and I were at an event there, and it smelled strongly. It tastes strongly of
You
methane.
couldn't drink the water. It was
Yeah,
it was bad.
It's really it's a problem for that homeowner. I know it sucks to hear, but it's like if you have iron in your water, you need to get a softener. This is one of those issues where that's a homeowner issue, and unfortunately, some of that area has those problems.
But there is something they can do about it on a
Yeah.
personal level? Okay, I just don't know what you would do.
I mean, is the water actually explosive?
I mean, from what we were told, at least one homeowner can light their water on fire, but we have not physically gone out and seen that I'm aware of. The person that said they can light their water on fire, I have not physically seen that.
Yeah, that'd be something to see, I think.
How many residents is it?
Yeah.
We've only been told about one. There may be a second one that was mentioned, and then the Parkman Town Hall itself has an issue. And I only know that because when Miss Brakey and I were there, I mean, the water was, I would say it's undrinkable.
Yeah, it was
But-
very stinky.
That is an issue where you have to get the appropriate stuff to in essence diffuse that out.
And with the previous wells, they didn't have this
Not sure
level
about
of
that.
problem?
I'm not gonna say we know 100% for sure if they did or not. I mean, because they had the other issues with those wells. We don't know exactly if they had that much methane in those or not. Given that what the township hall has in it, I can't imagine no one else had an issue with how strong theirs is.
So did this house, it just appeared out of nowhere though? Is
Uh,
that what
yeah.
happened or is it progressive?
Well, from what we were told, it just happened. You know.
That's what's odd, because if it's
Yeah.
part of the landscape and everything, then I
I mean,
would think it'd be.
I mean, Dan would know more than I do, but I mean, the water does move. But
Yeah, so if I remember right, what we were told is that aquifer, you know, there, if you remember, they were talked about there being 3 aquifers through that region. And the first one was the one that kind of got the salt in it, salt issue. The middle one, I believe there was an issue with that, and they actually went to the lower one. And so that lower one, they said, was kind of known to have some levels of methane in it,
Okay, so it's-
naturally occurring.
Okay, so just a result of the drilling
Yeah.
and being
Yeah.
in that aquifer?
Yeah.
Okay, so
I want
that's,
to say the middle aquifer, even though there's only 2, they call it 3 with how it's stratified. But the second one, I think, had natural gasoline, the gas,
well, that's what I was
oils and
wondering with
gases
the
in it.
methane. I was like, someone should
Yeah.
be drilling for nat gas.
You would
around
think
there.
so.
Well, they were
Yeah.
right in that area at one
Yeah.
point trying to find, they had a test drill up on, I can't remember what road, but they didn't end up doing it. They were trying to frack in that area a
Yeah,
couple years
so I
ago.
wondered. Yeah, because we still get oil. rights
But
on
what's the likelihood that we actually are going to have a house explode from
Slim.
this?
Not being an expert on it, but I would think very slim
Yeah.
to
that.
none.
Unless somebody tries to light.
Yeah.
I just don't want to see it on the evening news, having talked about it at a board meeting.
I would imagine the town hall would went up years ago. And
Please
they-
contact a well
Had that
driller and get a,
building.
Yeah, that was a rough one.
please
I
treat your
thought they were
water.
planning for this Halloween, an explosion.
Maybe.
Bonfire.
Health Commissioner's report.
No updates other than what we mentioned with HDAC.
All right. Any questions for Ron?
The one thing in the Health Commissioner's report on the cancer deaths, the 402, they related it to smoking, drinking, poor diet, not getting vaccinated. I wasn't aware of a strong relationship between not getting vaccinated and cancer development.
So
The only
potentially do like
cancer that-
HPV and-
Yeah, I have to go back and look at the article, but I can give you more information on that. But yeah, it seems like there's some new stuff coming out. Just, I think the volume of data and AI is starting to change that landscape of how they can assess data and go backwards.
So HPV is the only
Yeah.
Right,
cancer
H-
reducing.
And that's that's newer than the old pre-existing
Mhm.
vaccines.
Yeah,
Correct.
relatively speaking.
Relatively, and
But
it-
that's the only one I was aware
it
of.
does protect
Me too.
against oral
Right.
pharyngeal cancers. It protects against cervical cancer.
Mhm.
I mean,
Mhm.
and
Yes.
and those are cancers that do kill people. So
Mhm.
I guess you could say it saves lives.
Yeah, I guess the other update was, we originally thought the data project was going to be exclusive to Lake County the first year, but working with UH, you're gonna try to get the data for all the counties, all 7 service areas. So that'll be
Great.
actually very
Yeah.
good for us,
Be
for the
really
assessment we're working on.
And HPV's been a recommended vaccine for how long now?
Oh, gosh.
20 years.
Oh, yeah,
Yeah.
right around there.
Yeah.
Yeah, it was
So-
like when I was in my 20s it came out, so probably.
Yeah.
It's been a while.
When Sarah Palin hit her fame. Yes.
Actually got it.
If no additional questions, go to old business. And first one, I left these on there in case you want to have discussion, but it's the rent space discussion. I'm not aware of any updates on that or any.
So we haven't gotten a draft contract or anything? Nothing?
Mhm.
Okay, so the
Not-
ball's in their court, right?
It's just everything that we had provided previously is all that there is right now.
Yeah, I think I'd offered to start to draft something up, and we kind of thought that why rush
Yeah,
Yeah.
might
to the
as well wait
finish
for
line
the
when
opinions
it's in
before.
limbo, then we're not paying for now.
The housing code section, or housing code is the next old business. I did talk with Mr. Olashev. He stopped by, I want to say Friday at the health department and talked. My point, I think, when Dan and I spoke, and Ron spoke to you guys last time, it probably costs us $100,000 to do a housing code. So you're gonna have to have a person, because at least for the first couple of years, it's probably gonna be a hotbed like everything else when it starts being looked at. We don't have $100,000 to throw at a person, and I wouldn't want to lay someone off just because, all right, we've done it for 3 years, now it's less, we're gonna lay somebody off. I told Mr. Olashev, with places like Aquila right now and their struggles, so they're looking to condense. Everyone's looking to cut expenses, not expand expenses, and I can't imagine some of these localities, some of the subdivisions want to give us an extra $10,000-15,000 because the levy's set, so I can't increase the levy. It would be local dollars. And I can't imagine anyone has $100,000 they want to throw at
This is
us.
a very atypical program for health districts to operate, so it's not very, common we have in our county, just Lake County's kind of its legacy and its value. We can't get it out of there really now.
And that lake is very, very different from Jaga, and I think
Yes.
that, I absolutely agree. I think resources limit it, but I also think enforcement limits it, but also impeding on, the rights and things of our, Jaga County is something that,
I
we
still
certainly
s-
want to help with the nuisances and make sure people are safe and healthy.
Right.
And I think that ultimately, we can look at these at a case-by-case basis, but I agree. I think the funds are the,
Yeah.
rate limiting factor here.
It's still, obviously, it's a nightmare to enforce, but I look at it as, it's a loaded gun that you point at somebody.
Yes, that's
And
right.
it can be subjective who you point it at. So I would be mindful with how that is. And some people like to live with things in the yard, other ones don't have things in the yard. I mean, that can be
Yeah.
pointed all kinds of different
As
directions.
long as you have
So,
quiet enjoyment, it's fine.
Yeah. I
Right.
mean, the other one, the last whole business is the resolution to increase certain fees, food service program, second reading. These are the fees we read before, just the second reading. Dan, we have to do a motion for these, correct? Just for the reading or no?
Yes.
I think we have to do a motion, right? To
Yeah.
accept it, yeah. So if we have a first for the second hearing and a second?
I'll first.
First.
Second.
All right, all those in favor?
Aye.
Aye.
All those opposed? Any abstentions? All right, none heard. And then moving on to new business, we have the financial report, which I will pass down in case anyone didn't look at it. But any questions on the financial reports?
What is the giveaways for $1,200? Is that the raccoons?
Yes, that sounds about right.
Giveaways.
Yes. We did,
That's curious.
most of the other stuff, we use either the GPH credit card or I just get reimbursed for it, so, because we do have some candy for the fair, and then we have trunk or treat coming up in October, and so we have some candy for the kids for that as well. And if you want to see me dressed up in an inflatable Mario outfit riding a Yoshi.
We do, yeah.
You can see me there doing that.
Yeah.
So,
Can you also wear it to the Board of Health meeting?
I mean, I could try to sit
On the
down with
30th.
Yoshi's head just
You
bouncing up
guys
and
are
down
in
the
charge, you
camera.
can make that request.
Is that a motion or resolution?
Yeah,
Seriously though, we should wear costumes to the October meeting, I propose.
I
Hey.
like that idea.
I mean, I will gladly
Is
wear
there a
it. I
theme?
mean, it's being
No.
requested.
One.
Any theme for adults with limited costumes. So. And then the other question I had was about the training for $10,000.
Yeah, so we had workforce development dollars that had to be used specifically for a training program. So we had someone come in, Lake County paid half, we paid half, and had the training. That also includes the access to the software, Ron.
Yeah, there's a software basic, so we had to put up long-term training since the state gave it to us. We had 20 total, so we did some like in the moment training, and then the rest is like a catalog of virtual training plans that you can
Oh,
put
I
together.
see. I was gonna ask what training you get
Health
for $10,000.
department.
It's a heck of a training.
Yeah.
Get
Yeah,
massages
so
during it or
yeah.
something.
Perpetual virtual stuff.
I mean, if we get that money again, I'll keep that in mind for the next time.
But that's all state grant. It sounds
Yeah,
like that was
it was
covered.
100% state
It was
funded.
like carryover money that they had to get rid of, and that's
Yeah.
what it shows. It had to be workforce development.
Did you sign this? Is this your- okay, so
And
make sure-
even though we wanted to use the money differently, it was actually required it had to be used that specific way,
Yeah.
which was fun. But we'll have to do a first and a second on that. But any other questions?
No, that was it. Thank you.
All right. Otherwise, need a first and a second for approval of the finances.
I move to approve the financial reports.
Second.
Second. All those in favor?
Aye.
Any opposed? Abstention, same sign. All right, motion carried. And then we have, these are the ones I passed around to a couple of you before we got here. These are just the permission to increase and decrease appropriations. What we have to do is because when Lake County bills Geauga, it's the general fund that pays everything. We have to transfer the money from the other funds to general fund to pay that bill. And so that's what most of this is to transfer that money to the general fund to
Can
pay
you
the
say that
bill.
one more time, Adam? I'm sorry.
Yeah, so the general fund, which is like your general banking account,
Yeah.
all the bills from Lake County hit that fund and it pays it.
Okay.
The funds that, like if you're a sanitarian, the money comes in a different fund, we need to transfer from
Oh,
that
okay.
fund to general to pay it back.
I understand.
And so we've
And
been working with.
that's kosher to do it that way?
Yes, yeah, we've been talking with the county, auditor to make sure this is how they want it done. And this
Right.
is
Well,
the
that's kind
final-
of what I was,
Yeah.
okay.
This is something we
But-
tried to do a while ago and they want it done a little bit differently, so we modified it and we finally got to where we believe that's how they want it. So we should be good.
And
Yeah.
just the paperwork,
Uh,
do we need a motion?
Yeah, we'll do a motion, a first and a second, and then
Oh.
there's signatures on a lot of these.
Yes, there are a bunch of them.
Yeah.
I so move. We have a second.
What are you moving for? I don't understand the motion.
So it's the permission to increase appropriation, or sorry, permission to approve appropriations for increases and decreases. They're all increases, but
Okay,
it's the transfers.
I understand. I'll second the motion.
All those in favor?
Aye.
All those opposed? Any abstentions? All right, motion carried. And take your time, if you have any questions as you read through them, just let me know and we'll go through them. Again, it's mostly, as you're gonna see, the increase here is transfers. Out is gonna be the primary increase, with general fund being in, transfer in.
And they're all, like the in and out are all equal, correct?
Yeah, they have, transfers have to equal out,
Okay, that's what I assumed. I just wanted to make sure.
yeah. And a lot of this is decreasing salaries from when the contract took effect. I'll let you guys go through those before we go to the next one, just so we're
So
not.
they're basically primarily salary and benefits.
Yeah, we're just reducing salary and benefits and increasing transfers out. And we'll have to do this again towards the end of the year. We did this one kind of a 6-month section, and we'll do the next one again when we transfer money out, or transfer money in, I should say, sorry.
This is where you can tell the doctors sign their names a lot.
Yeah.
You guys are so much faster.
Nothing can
than-
happen in medicine without a doctor's
Yeah.
signature.
No matter how squiggly liney it looks.
Yes.
Can't even read it.
Just when the notes get bad, it's hard.
It's hard to forge a signature when it doesn't look like a signature.
Or digital.
A bunch of these.
There are, it's every single fund pretty much
Yeah.
requires that transfer.
The swimming pool.
So even swimming pools. We have inspections for swimming pools.
Is the injury prevention fund working?
I think there's less injuries, so it's definitely working.
Good.
Adam, are you okay that I vote specifically on
Yes,
infectious
yeah,
disease? I was saying it's
um,
just a transfer of funds, but just to.
Yeah, just mark abstain, or
You want me to abstain on
you
this
can,
one?
you can if you want. You
Okay.
don't have to because it doesn't impact.
I'm fine with saying yes to
Okay.
it, as long as you guys
I thought if
are.
you were
It
saying you
does
wanted
not-
to abstain, I was gonna say that's fine.
No,
if you
it doesn't
want to.
pertain to anything
Okay,
at all.
yeah. Yeah, these are generic, just the moving
Yeah.
dollars from A to B. And usually you would vote on these in the past, that I can recall.
I would.
Yeah,
Yeah, the
I don't
transfer of
recall.
funds,
Yeah, I don't
yeah.
recall you not voting on these.
How many are there?
I was gonna say,
There's like-
I thought we just did a blanket yes.
Usually we do, but these transfers, they want each one of them signed because
Specific.
it's so many of them.
Okay.
So, but we have to do them individually because I
Start
can't,
trying new ways to sign my name on these.
I have to have you guys
That's
approve
right.
individually to get it passed.
Yeah, the board does
Next
need
is
2
the
hours of
change of the
CEU
day.
credits every year.
This
Is there any
counts.
topic that you guys would like to have presented, maybe starting in October, last quarter?
Robert's Rules of Order.
We can do
All
that.
right?
Yeah, actually, that's
Yeah,
probably
okay.
necessary.
Well, I'll put them together for October then.
Is that something we all do together here?
Yeah,
Yeah.
yeah, typically you've had so many new learning curves, you kinda just have to certify at the end of each year that you get the 2 hours, so you outside professionally will get the credits if you wanted to document it, but it's just easier to have a section in the Board of Health and do some topics that you guys wanna hear about.
Then we'll need a motion and a
Yeah.
vote.
Yep.
And after we're completed with this, next will be permission to change the date of the October Board of Health meeting, which has to do with
Yeah, so
community event.
yeah, so there's trunk or treat. Ms. Brakey pointed that out, which I appreciate. So trunk or treat is on the same day as our board meeting. That's at 6 o'clock, if I remember correctly. And then my staff and I will be setting up before that. So instead of trying to squeeze this in, and the other reality is they use this parking lot to shuttle people back and forth.
Yeah.
It's hard to get in here and it's hard to get out. So if everyone would entertain that motion, it would be to move it back to there's actually 5 Wednesdays in October. We'd move back to the 30th. I don't think there's any Halloween type things on that day off the top of my head. I didn't see a whole lot. But we just bump it back 1 Wednesday and have our meeting on the 30th, if that would be so amicable for everybody.
So I would move to change the date
Yes.
from the 23rd to the 30th.
Yep.
And need a second,
Second.
and then,
All those in favor?
aye.
Hi.
All those, anyone opposed? Any abstentions? No, motion carried.
What is the date of our September meeting?
September will be the 28th.
Okay, I will be.
25th, sorry, 25th.
I will be in Phoenix. I will not be here for that day.
Okey-dokey. You want us to move it to Phoenix?
We could go to Phoenix with you.
Yeah. I
It's
think
hot there.
Okay.
Not so
Wait till
bad.
We got any
February.
more? We good?
that's
Okay,
it.
collected the whole stack and
Yeah.
then we
You
have.
signed your life away.
I know.
The last thing is if you would so like, I have an update on that, on the legal matter at the time. If you guys want, we can go into executive, do that, and if not, we
Let's
don't
do
have to.
public comment first,
Yeah, we can do that.
and then we
Okay.
can go.
So
into
next would be public comment, citizens' remarks, which is session to last 20 minutes unless the board moves to extend, 2 minutes per speaker to make comments and ask questions. Board will answer questions after having an opportunity to investigate responses following the meeting. It's not a press conference where answers should be expected on the spot. And board responses will be recorded and publicly filed with meeting minutes. Any,
Vicky will say
Yeah, I
something.
know she's just waiting.
I really have nothing to say.
Oh,
Can you believe that?
I'm playing the lottery tonight, folks.
yeah.
Official meeting.
Well, then, there'd be no action taken after the executive session, so you don't have to stay if you don't want to, but it shouldn't be very long. I'm thinking just a couple minutes and then we should be done.
Okay.
But if we would like to go into executive, I can give you guys a quick update, probably 5-10 minutes, and then we can be done.
All right. Do you need a
Subject
motion?
to legal.
so we'll go to executive?
Yeah, so we'll do a roll call, be permission to enter the executive session to discuss pending litigation. And I would need a first and second, or sorry, yeah, first and second, I mean.
So I move to go into executive session. Do we have a second?
Second.
All right, so then roll call vote, Dr. Henderson,
Aye.
Dr. Rude,
Aye.
Ms. Bradley,
Yes.
Melissa?
Yes.
I'm not gonna try, I'm trying, I'm gonna last name, Ms. Jones?
Yes.
All right, so we'll go to executive session, and then we'll come back down here in a couple minutes.
22 minutes. Is that a record?
I'm trying.
That is.
That is.
I am
Nice
trying.
one.
Is there something to be for this?
Yeah, he's a big name.
I'm like, something must be happening now.
Yeah, you too.
Mr.
As quick as I can.
See ya.
Skip
Likewise.
over the minutes at first too.